Welcome to another Inside Lyme Podcast. You are listening to a show dedicated to discussing actual cases. Dr. Daniel Cameron has been treating adolescents and adults for more than 30 years. He feels that the best way to get to know Lyme disease is through reviewed actual cases. Please remember that the advice given is general and not intended as specific advice as to any particular patient. If you require specific advice, then please seek that advice from an experienced professional. Now please welcome Dr. Daniel Cameron.
Welcome to another Inside Lyme Podcast. I'm Dr. Daniel Cameron. I will be discussing a 15-year-old boy with severe cardiac problems associated with Lyme disease. Nawrocki and his colleagues first described this case in the Air Medical Journal in 2018. A 15-year-old boy experienced an episode of exertional syncope while at a trampoline park. Syncope is a temporary loss of consciousness. He had a history of attention deficit hyperactivity disorder. His friends immediately called 911. They were not sure how long he was unconscious. The boy was pale with a heart rate of 300 beats per minute, according to the medics. His EKG showed a wide, complex tachyarrhythmia. That means the heart rate was fast, and the QRS part of his EKG was wide. He was given a dose of amiodarone, A-M-I-O-D-A-R-O-N-E, but the ventricular tachycardia remained a problem. Amiodarone is a medicine used to treat and prevent irregular heartbeats. At the hospital, he was dizzy and short of breath. His heart rate remained between 290 and 300 beats per minute. His blood pressure dropped to 66/30, which is quite low. He required synchronized cardioversion. Synchronized cardioversion is a procedure similar to electrical defibrillation, except that in synchronized cardioversion, they use low energy and they synchronize the energy with the heart. His EKG changed to a third-degree heart block. That occurs when there's a complete loss of impulses from the atrium, which is the top of the heart, to the ventricle, which is on the bottom of the heart. He had pacing pads placed. He was flown to a cardiac intensive care unit at a children's tertiary care hospital via a rotary-wing aircraft staffed with 2 flight nurses. He continued to have a complete heart block with a fast rhythm. Doctors suspected Lyme disease and prescribed intravenous ceftriaxone. The diagnosis of Lyme disease was confirmed by anti-Lyme titers and Western blot tests. His low heart rate and low pressure continued. The doctors inserted a transvenous pacemaker to control the heart rate. He had 3 additional episodes of ventricular tachycardia. He was also cardioverted twice, but after several days of intravenous antibiotics, the boy's heart block gradually resolved and the pacemaker was removed. He completed 28 days of intravenous treatment. He remained well on a 1-year follow-up visit, according to the authors. The authors note that conduction problems have been reported previously in untreated Lyme disease patients. The list of conduction abnormalities include first and second-degree AV block, ST and T wave changes, prolonged QT, junctional tachycardia, and complete heart block. There was no mention of conduction problems in patients who have been treated. What can we learn from this case? Lyme disease can lead to life-threatening rhythm disturbances. The conduction problem with Lyme disease can rapidly change. A pacemaker was necessary in this case. The doctor was able to remove the pacemaker after treatment with antibiotics. What questions does this case raise? How often does Lyme carditis occur? Are there cases of Lyme carditis that are not diagnosed? Were there any warning signs of Lyme disease that would have allowed treatment of this 15-year-old young man before he collapsed? Would the doctors have been able to recognize Lyme disease early before the need for hospitalization, air transport, and cardioversion? Many patients are complex, as highlighted in this Inside Lyme podcast series. We need more doctors with skills recognizing Lyme carditis. We hope that professionals evaluating individuals with Lyme carditis can use this case to remind them to look for tick-borne illnesses and treat accordingly.
Thank you for listening to another Inside Lyme Podcast, a show dedicated to discussing actual cases. Keep in mind, the notes for this episode and all episodes can be found on our website at danielcameronmd.com. Sign up for our newsletter to keep up with our cases. As always, it is your likes, comments, and shares that help spread the word about this podcast and our work. If you can, please leave a review on iTunes or wherever else you get your podcasts. Until next time on Inside Lyme.